Good afternoon, everybody. It's 12:45 on Tuesday, so we're going live with our questions for the Ask Me Anything hour. Just as a reminder, every Tuesday and most Thursdays from noon until 1, we are doing Ask Me Anything hour. Last week, unfortunately, we did not have Ask Me Anything hour. We were invited to be featured at the Mammoth Film Festival with the Strong and Health box, so I apologize if you were trying to get some questions in then, but we will get to them now. I actually want to start right away with a keto question that we had. And this is for Mary. Mary, thanks for watching and for asking the question. But she wants to know if the keto diet would be something okay for someone with non-alcoholic fatty liver disease. And quite honestly, I couldn't encourage you more to look into doing this, because if you think about what are the causes of non-alcoholic fatty liver disease, but those are going to be coming from excess carbs and sugar. So when you do go into a keto diet, you're reducing as much as possible your sugars, your carbs. You're going to be taking that stress off the liver as much as possible. Now, you still want to be supporting your liver as much as possible. And those are going to be the vegetables that we talk about. Your beet greens, your cruciferous vegetables, your broccoli, your kale, your Brussels sprouts, cauliflower. And if those gross you out, remember, you don't have to eat a ton of them. It doesn't have to be a bucket, just a small amount. Even a little handful every day is going to make a huge difference from someone like that. Now, there are multiple other things that I would do personally if I had non-alcoholic fatty liver disease, but I would definitely start with a keto diet and increasing those high vegetables. Really important. Thanks for the question, Mary. And also, Kaylee, we had a question from Kaylee about seafood. Somebody who doesn't like seafood, should they be taking a fish oil supplement? That's a really great question, Kaylee. And by the way, you have a box waiting here for you, so don't forget to come in and get your digestion box when you're around. Anyway, seafood. So there's a lot that you're missing if you're not eating seafood. And I know there's a lot of people that I talk to, I say, look, just eat some seafood, and they make this face like, I don't eat seafood. You have to remember, it's not just the healthy fats and the proteins that you're getting from good wild-caught seafood, but it's other micronutrients that we do not seem to be getting enough of in the standard American diet. Number one being iodine. So if you are not eating seafood, I want to know where you're getting iodine from. You have to have iodine. It is essential for life. Remember, it's the number one most preventable cause of mental retardation in the world. It's important for brain function, thyroid function. Your whole body needs it. So if you're not eating any seafood, where are you getting it from? That's the question. So you're going to be looking at things like sea vegetables, like kelp or nori, what they wrap sushi in. You're going to want to look at foods that are grown on a coast, strawberries on a coast, things that are going to be getting that iodine from the sea, okay? But really pay attention to that, and that may be something that you would have to supplement if you're not eating enough seafood. Another one that's really important is phosphorus. Phosphorus is what we're going to be talking a lot about this month, because next month's box is the energy box, and phosphorus is essential for energy production. We get a lot of confusion over people getting too much or too little, but if you're not eating seafood, you're getting less and less options where you're going to be getting it from. You do get it from beans, you're going to be getting it from seeds. This is where it's super important that you are getting it sprouted. If you are not sprouting those seeds and nuts, most of the phosphorus is not bioavailable. And then we can talk about stomach acid and all that other important things. But think about iodine, think about phosphorus when you're not eating seafood. Now, that's just two of the ones, but also omega-3 fatty acids is the question, should be taking a fish oil. I'm of the opinion these days, from all the people that I speak to and the observations I've made, that no one seems to be getting adequate amounts of healthy fats. Well, not no one, but most people aren't. So if you are examining your diet and you're seeing that you're not getting good healthy fats in there, absolutely you want to get a good healthy quality fish oil. There are only a couple out there that I would personally take, and I can talk to you about that specifically, which ones those are. Okay, we have two questions left over from Dr. Schipple. When she was down here, we had a talk and we had a bunch of questions coming in. So one of them is, how do you control or stop hot flashes? This is a really interesting question, because we have to understand what's causing the hot flashes. The first question I would have is it a flash that you're getting, or is it sustaining? Are you getting a lot of heat, and is the heat continuing? Because that could be two different things. Sometimes it could be similar to when someone gets a fever, and that could have to do with calcium, not having enough good bioavailable calcium in your diet. Another one Could be iodine, what we just spoke about. That could be a portion that could be contributing to it. But the number one thing that I would look at would be adrenal function. Are your adrenals supporting, or been supported? Have they been nourished? Have they been overtaxed? Because when your body is going into a change in your life, when your ovaries aren't going to be doing all that your body needs them to be doing, the adrenal glands are going to be taking some of that slack. And a lot of times that can be a signal that is going to try to get your adrenals to do what they were doing. So take a look deeper at your adrenal function, and we can talk more specifically about different ways that you can do that for the individual. If you want more specific questions on that, please let me know. Last question from that was, what is the best way to find out if you have a vitamin or mineral deficiency? That is a huge question, and it's a really good question. But the truth is, it's very difficult to pinpoint one specific test or lab that I would say would be the gold standard for all micronutrient deficiencies. There's so many things that we're still learning, and there's so much that we don't know yet, that we have to just be, first of all, examining what you're eating and comparing that to what would be the recommended daily allowance of that first. That would always be the first place I would go. Make sure you're entering all your food and compare that to make sure you're getting enough potassium, enough magnesium, enough of all of these micronutrients. We spoke of iodine. In fact, there is a test that you can do for iodine, but it requires a loading process where you actually have to examine that and send it out for yourself. If somebody's interested in that, there's a great lab that you can go to and order it, and they'll send it to you when you're online. The rest of those, it's going to take a combination of really true study and understanding different blood work values and understanding your body's symptoms and the thing it's speaking to you. This is an art. This is definitely something that has a lot more studies, so there's no easy answer to that, to say if you do this test, you'll know exactly what your deficiencies are. But what I would suggest for someone who's looking for that is first, record all your food, put it into one of those chronometers or some type of an app that's going to tell you how much you're getting, and pay attention to that first and make sure that you're getting a daily dose of all of those things. Okay, we had a question last week about diabetic diet, and what would somebody do if they were a diabetic, how would they eat differently? And what I asked them to do is send me some examples of what you are eating, because it's so much more important to start where you're at. Make small changes, remove one little thing, add one thing in, unless you're ready to go, go hard or go home. But this person eats a lot of fried foods, lots of fast food, terrible things, they say, out of cans like beef stew. And when they eat Mexican, they put so much cheese and sour cream on, and they also drink Dr. Pepper. So these, where would we start with someone like this? Obviously, there's a lot of opportunity for this person to eat a lot healthier. And the first thing, if I were concerned about diabetes, that I would talk to this person about is seeing if they can go a day without Dr. Pepper. Because that liquid sugar is going to be the number one thing that is so devastating to their body. And if this person says, well, I don't even finish the Dr. Pepper, I only drink a little bit of it, great. Do half of what you were doing already. See if you can go every day with half of what you're doing. See if you can go down to zero, but slowly work that Dr. Pepper out of your life as much as possible. And if you cannot even imagine a life without Dr. Pepper, and I understand that there are people out there like that, it's part of the culture, find a day that you can give yourself a little bit so that you're not thinking that you have to completely remove this for the rest of your life. But for most of the time, you really want to get that out. If you're going to Mexican restaurants, I am going to be going today for lunch, as a matter of fact, and there's always guacamole on the menu. Please get guacamole because it's going to give you some vegetables, it's going to give you your potassium, your magnesium, your fats, your fiber. There's so much going on in that. It will fill you up and make you feel more satisfied. Start with that, and you don't have to get chips to dip it in. I eat it with a spoon, okay? So you can do that, and I know that we talked about beans before and being a high carb, but if you're worried about the good, better, best, I would definitely prefer that you're eating a little bit of beans so you're again getting that potassium, that magnesium, that fiber, all of the micronutrients that you need in there. And I would remind everyone out there, and a lot of people ask about Dr. Gundry saying, well, what about the lectins and what about these? The people in the world who live the longest, people who live in the blue zones, they have the lowest rates of heart disease, lowest rates of cancer, lowest rates of obesity, all have as a foundation beans in their diet. So there is a disconnect there between the two, and what the difference is our digestive capabilities. Well, it's one of the differences in America. So make sure you're supporting your digestion so that you can eat these awesome foods when they are appropriate for your diet. Okay, next question is on intermittent fasting. What would be recommended guidelines. Excellent question. Definitely encourage people to experiment a little bit with intermittent fasting, also known as time-restricted feeding. The very first place I would encourage everyone to start to do is to make a 12-hour window your eating window. So you have effectively 12 hours of fasting to give your body a break from all of that work it's doing. If you're going to eat your first meal at 8 in the morning, do not eat after 8 o'clock at night. Start there. See how that works for you. If you're already there and you want to take it to the next level, see if you're eating at 8 o'clock in the morning, maybe you can stop eating at 6 o'clock at night. Try to increase that window a few days a week, maybe every other day, to see which one you can do. Now, some people do it the other way around. They don't eat anything all morning and then they eat in the afternoon. And that's fine. It's just not the way that I prefer to do it. And that doesn't seem to be completely supportive of nature. However, I do typically start eating around 10 a.m. and I usually stop eating before 6 o'clock, and that would be my version of intermittent fasting. Some people like to get it down to even one meal. I wouldn't suggest doing that right away. I would definitely slowly move towards that and maybe have one day a week where you would do that intermittent fasting where you're only eating between, say, 10 o'clock and 2 or 4 o'clock in the day. You want to eat when the sun's at its highest according to Ayurvedic medicine. That is something to think about, and that's one of the things that I've been experimenting with myself. I hope that satisfies your question, Brenda. If you have more questions, let me know. What home water filtration system do you recommend to remove chemicals and heavy metals? This is a great question, and this definitely shows how I'm always striving to be practical with people, always trying to find a way to make sure that the suggestions we're making are actually something that people will actually do, because of course there's ideal, and there's an ideal life that we all know we could be doing better, and then there's a life that we can actually do and slowly have some successes and wins so that we know we can keep doing more and more and more. I like to set people's expectations at a practical and achievable level. So the number one thing that I would suggest for people who are trying to remove chemicals is actually putting a filter on your shower. There's a lot of chlorine and fluoride and a lot of different chemicals that are really harsh for your skin and quite honestly can be displacing the iodine that we spoke about earlier for all of those who are concerned about thyroid health and your iodine levels. It's very cheap. You can go to any one of your Home Depots or one of those types of stores. It's like $15 to $17. You just take off the shower head, put on a little filter. That's going to do a lot for the chemicals there. Now for drinking water, for those of you who really want to go for it, honestly, a Brita can be very helpful, but a reverse osmosis filtration system is probably the absolute best you can do. I personally don't have one in my house yet because it is something that is a little more of an expensive commitment, and I haven't taken the time to do that. I stick to spring water for drinking for the most part. That's the way that I get around that. We do use a Brita here, but on the showers, I definitely put that filter on there. So again, there are many levels to it, and some people are actually better at that than I am. So good on you guys. I'm trying to catch up. I'll get there eventually. Okay, and I had finally a question. I'm going to put this picture after we're done here. About a drink that someone brought in, and they were curious if this is something that they can use as part of their diet or if it's something they need to avoid. Thanks for the question, Brian, because when you look at the label, it's very important to look down there for certain things that are unnatural. Okay? If you're finding things that are not occurring in nature, you're not going to get a green light from me to put it in your body. If it occurs in nature and it's a food, then it makes sense. But sucralose was very boldly put on this, and that is one of the things that I would encourage all of you to do a Google search on the ill effects of sucralose, and there's a whole history behind that. But the number one thing to remember is it's unnatural. It is not occurring on the planet. Your body has to deal with it as such. There is no design in the system to utilize sucralose for benefit. It is going to be something it's going to try to get rid of, and it's not easy. And then when you look at the rest of the label, there's a lot of synthetic vitamins in there. And you can tell that they're synthetic by the way that they're saying that they're formulated. Synthetic vitamins, again, are something that are created in a lab, and they're not the way they're occurring in nature. You have to be very careful. There's a lot of information out there talking about how this vitamin's bad and this vitamin's bad, or they have a problem with all of these. And those studies are being done on synthetic vitamins, not vitamins that are coming in whole foods, not the ones that are being packaged the way that Mother Nature has prepared them for us. So be very careful when you are doing synthetic vitamins. Look at the labels, make sure there's nothing on there that is completely unnatural, and really try to find your vitamins in a form that is packaged by nature as opposed to created in a lab by one of these major companies that the FDA rightfully is coming down harder and harder on in the nutritional supplementation area. Finally, thank goodness they're doing that. Okay, Thank you guys all for, one last thing before I let you guys go. And please, if you do like this information, please do share it with your friends, like it, share it, let people know that there are other ways that we can look at our health to empower ourselves and make sure that we're making choices that we feel confident in and that makes sense to us as individuals, instead of just feeling as though we're kind of in this area of misinformation and confusing information. We're going to do our best to distill it down to what makes sense to you and make sure that you understand why we are explaining things that we're explaining them. Many times I'll have people talk to me about antacids and digestive problems. And somebody brought this in to me, and this is actually mostly in Spanish. It's an antacid that was given to them. And I just want to point out, even on this one, it very clearly says not to take this beyond 2 weeks. Read the labels on these types of medicine, guys. There's a reason that they're saying that this should not be done for 2 weeks. I wouldn't use this at all, honestly, unless it was an absolute emergency and I ate something crazy and, I don't know, lost my brain and all of a sudden I had all of this terrible acid reflux. But, and this is very clear that it says do not take it for longer than that. And I want to remind everybody out there who is taking antacids or taking some type of proton pump inhibitor or that, make sure you're reading what it says. Read the research on there and understand if you're putting that in your body, there is a time period that is appropriate, even according to the clinical research that's been done on it, and there is a time period that says you should be looking at other options and figuring out why you need this so badly. Okay, thanks for watching, guys. Really appreciate the questions coming in. We will keep those questions being answered mostly on keto on Thursday, but all kinds of questions are welcome. Have a great week.